11.
Liverpool Live.
Right then, so June Nash is with us. Joe Nash is with us. June Nash must be somebody I went to school with. That's all I can think of. Sorry about that, Joe. So one of the interesting things, because, I mean, the services there. People go to the walk-in centre and you encourage people to go there if they have something that is of concern to them. But at this time of year, what are the couple of, basic little things that you need in your toolkit at home, or maybe practices that you need to be kind of carrying out to kind of mitigate the possibility that you might need to go to see the NHS?
So I think, in your medicine cupboard at home, the basics like paracetamol, ibuprofen, maybe an antihistamine, for your basics of like your cough, cold, sore throats, ear pain, a lot of the time symptoms can be managed with those over-the-counter remedies. For injuries, like ice packs, and having something, knowing what to do, if you burn yourself, to make sure that you do run it under cold water for a good sort of 15, 20 minutes, not just
Is that what you should
a
do?
couple of minutes
Blimey, I burn myself
and
all
then
the
run
time.
off to the walk-in centre. It's those key things that will just help prevent that damage and,
I didn't realise it. I'm one of these
term,
people, when I think, oh, God, I'm toasting, I'm putting some cheese on the grill, and I'm like, and you can, just put it on for a couple of minutes.
Exactly,
okay.
yeah.
So the longer you do it, the better it
Yeah,
gets,
because you want to prevent that sort of, the continuous burning and potential damage to the skin. We do have a lot of patients that come in, that haven't tried those over-the-counter remedies, and if symptoms are mild and you're well otherwise, those are probably some of the first things we would advise you following examination. Obviously, everybody's different. Some people have a really high pain threshold. Some people can't take certain medications, so it does limit what they can do at home. But certainly, there is information out there, and if you try some of the sort of basic treatments, you might find that your symptoms may resolve on their own.
Yeah.
So, certainly if they don't, or they particularly get worse, then absolutely, come and access, healthcare.
And I know you've got to be a bit of a broad church, really, where you are. But we were talking off air that, people are really struggling, with their general mental well-being, really, aren't they? Because there are so many things, external things now, the cost of living crisis being one, all of this kind of stuff. Is that something that a walk-in centre can help with, or is it better to kind of signpost it to someone who's a bit more specific in the area?
I mean, primarily mental health isn't our forte, and it's not something that we would treat as nurse practitioners. Mental health covers such a massive array of signs and symptoms and diagnosis that it's not the place of a walk-in centre to manage, because a lot of these things are things that need to be sort of treated.
It's a long-term kind of process, that as well, isn't it?
Sometimes.
Yeah.
So in terms of sort of medicating and treating patients from that respect, that wouldn't be our forte. Certainly we can signpost you to things like talking therapies, charities in particular that are around Liverpool that will help people with mental health. And we are certainly seeing lots of patients presenting with mental health because they're unsure of where to go, or perhaps they're not registered with the GP. Reasons that, some of the new students to Liverpool haven't registered with the GP. We have a lot of visitors, asylum seekers, and, as you say, life is really complex, really difficult. There are a lot of stresses that are affecting people's mental health, and people who probably who normally think they have quite a robust and resilience with their mental health,
so much you can take,
find it
isn't there?
difficult.
Yeah.
Absolutely, and we do our best. We signpost to Talk Liverpool, which is a really good service for talking therapies. But you do need to be registered with a GP to access those. We work with certain charities like the First Person Project, which is quite a new charity.
I know Matty,
and they've been brilliant for some of our patients in the walk-in centre who don't necessarily need to be started on sort of treatment, but just having someone who can listen and can give them some coping mechanisms to help them manage, the way that they're feeling at that time, because, we're not going to turn anybody away. If you would need someone to talk to, certainly, present to a walk-in centre. It's not our forte, but we will certainly signpost you to people who can help you. And, that is, another part of our service, is that if we can't, treat
We'll get
and
you to
manage
somebody that can.
your symptoms. We'll refer you on to hopefully someone that can.
What about nutrition? Because, I mean, these days people, because we've just been highlighting, the cost of living and what have you, do you find that people are not eating perhaps maybe as healthy as they should be? And that in itself could prevent, a trip to the doctor.
Absolutely. I mean, nutrition is really key, not just for your physical health, but for your mental health. And, if people aren't able to afford, sort of good, sort of nutritious and well-balanced meals, or they're skipping meals particularly, it's going to have an effect on every other aspect of your life. Your ability to concentrate, to focus, to your ability to carry out, your daily tasks. It's so important. And I do feel, it's incredibly hard for so many families and individuals out there
To get it right. One of the key elements for me is water, and I don't drink enough water. And I've noticed when I have been sensible enough to do it, you notice a difference in yourself. You're more alert, your skin's better, all of these kind of things. So sometimes the most basic and simple things that you can kind of add to your life are the things that can kind of, keep you in the tip-top condition you need to be in. Well, listen, Joe, thank you so much for coming in. Much appreciated. If people want to find out more about the campaign, Help Us, Help You, is there a website that accompanies that?
Yeah, you can go to the Mersey Care website and all the information is there. There's information about all our walk-in centres. We have got 8 walk-in centres in total that cover the Sefton, Liverpool and Knowsley areas. So the contact numbers, opening times are all on there. So people can hopefully attend. And
Will you be in over the Christmas period? Is Christmas kind of one of these things? Oh, Christmas, what's that? We don't get those. How does it work for you in there?
Well, we are a 365-year service, day service, so we are open every day. All our sites will be open on Christmas Day and over the Christmas New Year period. So obviously, if people are unsure where to go, we are there. Obviously, like GPs will be closed, and certain other services like dentists and stuff, will be closed. If you're not sure, the walk-in centre is there. We are doing our best to help everybody. We are human at the end of the day, and we do get tired. All I can ask is,
have got to appreciate
we're there.
that.
It's an open service. You can walk in if you have genuine concerns, and our staff will do our very best to treat you. Just appreciate that it's really busy
Can't
at the
do it
moment.
immediately,
There are long waiting times, but we will get to you as soon as we can.
Right. Joe, thank you very much indeed for that. All right, then. You are listening to Liverpool Live. It is 11:33. We're going to be talking about knife crime in just a few minutes' time. Spotted music before that. From the Blow Monkeys next.
The music you know.